Hello everyone, you are all welcome to lecture number 1205, and today's topic is sleep anxiety, symptoms and treatment. This sleep anxiety is actually very much related to your emotion, feeling and mental disorder. The reason is that once night is there, and those who are suffering from sleep anxiety, and when time comes to go to bed to retire for sleep, some anxiety will be developed, they will feel some stress, and once they will go to bed for getting sleep, then already they are under stress, worry, irritation, emotional disorder, short breath. Lot of all these symptoms are nothing but fear, mental noise, how to get the sleep, and in that case the sleep is disturbed, and that is called sleep anxiety. And the chronic condition of sleep anxiety is called insomnia. And today globally, up to 20 to 30% global population is suffering from such type of sleep anxiety, where they are not getting sound sleep during night because of sleep phobia, I call it, sleep fear, and that is called sleep anxiety. In Nigeria, 27% Nigerians, they are suffering from sleep anxiety. In India, it is more than 32% Indians, they are suffering from sleep anxiety. And sleep anxiety is very dangerous in the sense that one thing is there, sometimes, occasionally, if you have some stress or strain, or maybe you have problem of sleep, that can be ignored. But if every day it is happening, that once you are going to sleep to your bed, you are developing some type of stress and anxiety, then it is dangerous in the sense that once you are missing sound sleep, good cycle of sleep for 8 hours, then there will be some other related health problem like heart problem, some your metabolic problem, because your metabolic problem means your digestive system, your gut health, they are directly related to your sleep and brain health. If mentally you are not sound, always you are in the state of anxiety, then there is chance of getting your digestive system, your gut in poor condition, your immune system will be compromised. So how to control your sleep anxiety? Let me make it very clear. The mother of sleep anxiety is nothing but, I call it overthinking. What we call it? Overthinking. Overthinking, many people are confused with this. Means that if you are always involved in deep thinking or reasoning, or sometimes you have family issue, then you are thinking about that, or maybe some mathematical problem you are solving, some chemistry imagination, they are not overthinking. They are everyday practice of your brain. Every human being, their brain is for 18, 17, 16 hours it is working. Once you are getting up in the morning, your brain start working. Even if you are sleeping, sometimes you are dreaming, your brain is working. So that is the work of the brain, of thinking, reasoning, thought process, subconsciousness, consciousness, all these things are thinking, they are not overthinking. So the confusion should be very clear. Overthinking means any negative thought process in your brain is repeating for hours. For example, just like you are coming and you escaped the accident and your life was in danger. So always that thing will start coming, negative thought process. Okay, I would have died. I would have died. That accident happened. I would have died. That is called overthinking. Or any event happened. That event is negative. Or anybody passed away. Or your loved one is having problem. Always that negative thinking is coming for hours. Always hours. Repeating. That is called overthinking. And that is, in common term, people are calling worry. And this overthinking is putting your brain under pressure, under stress, and even your hormone, that sleep hormone is disturbed. Your other hormones are also disturbed. And for that, you have to reduce such type of state of mind where irritated, negative, and always that thought process is moving, that one is disturbing you, that is called overthinking. So overthinking is serious issue. We must practice and you have to recognize. Here you are the master of your thinking and your overthinking, how to reduce. And there are some factors you have to take care so that at least your fear of sleeplessness or sleep anxiety is not built up when you are going to sleep. First thing, your room should be, okay. There should not be a lot of electronic gadget or light or noise, music, no. It should not be there. Also, it is better that from outside, roadside, noise, musical instruments playing should not be there. These are all disturbing elements which can add to your more anxiety. Then in the evening, you should not take any liquid or food which contains caffeine, like coffee, tea, alcohol. All these things you avoid, even the sugary material, because sometimes sugary material also triggers your stomach, and once your stomach is acidic, it also creates insomnia, sleeplessness. So these factors are very, very important. You have to take care to overcome the sleep anxiety. And one more thing I want to add here, it is global. Everywhere, majority of the people, they will get up around 3 a.m., whether it is America, Nigeria, India, everywhere. At 3 a.m., most of the people, they get up. The reason is that our melatonin, that is called sleep hormone, that sleep hormone for whole night, it will go on producing at high peak. But after 3 a.m., its production will start falling. It will be slowly reducing. The moment that stage comes that where the serotonin hormone is falling, there is chance you will get up. And after, when you get up, then again you can take some water or something, and again you can sleep. But sometimes when some people, they are getting up around 4-5, because of that your melatonin hormone reduction in production, concentration is reduced, then they may go for their morning walk and all these things. So here hormone also plays important role, because if anxiety built up is there, that is fear or phobia of getting sleep, then your melatonin hormone production will also be affected, and there will be production of stress hormone, because once you have anxiety, and because of anxiety, your stress hormone will be produced, that is called cortisol. So your hormone system in your body is disturbed. And to my understanding, you can discuss this issue with your doctor, and they may give some sedative. Actually, sedative is relaxant, and it also depresses the nerves so that you can get sleep. But better to avoid and try to modify your behavior and your all conditions and the triggering factors so that you can get sleep yourself. So these are all points I have mentioned here. Number one, the fear about falling asleep. So that fear of falling asleep once you go to your bed to sleep, that is called sleep anxiety. And number two, overthinking and ongoing worries. I have already explained the meaning of overthinking. Leave worry, start sleeping. Lot of worry you are keeping in your mind, just like dustbin. Keep away. Worry is not going to solve your problem. Your action is going to solve your problem. By worry, by overthinking, repeated negative thinking, you are going to kill your health. So try to overcome, and just you can solve this problem by just how to avoid these things, overthinking and worry. You should shift to such events, a moment of your life which was very good, beautiful event, maybe your some party or some friends or your degree or getting some very, very happy moment, that will reduce that anxiety. Number three, breathing difficulties. Once this anxiety built-up is there, you will feel short breathing, that is called breathing difficulties, and in this way the intake of oxygen will be less. So once you are feeling that anxiety of sleep, better you take deep breath, and deep breath will allow you to get more and more oxygen, and it will help you, because short breathing is again going to aggravate, and it will help in more and more sleep anxiety built up, that is insomnia. Number four, to recognize sleep anxiety, it is you are going to recognize your sleep anxiety, that is called insomnia, that is sleep disorder. Recognition means if once or twice in a month it happened, maybe because due to certain events, if you get new job, if you are changing your house to new place, you may not get sleep easily, you have the sleep problem, that is okay. But once always it is there, then you have to identify and you have to change your lifestyle, and you have to discuss this issue with doctor. Then a normal schedule changes. Once your normal schedule are changing, that can also bring sleep anxiety. Normal schedule means routine life. You are going to your job, coming in the night, going to your bed, all smooth, comfortable. But if in case you are going to take a flight to go to London or New York, where you have to sit in the plane for 10 hours, your jet lag is there, your sleep is disturbed. So that condition is also responsible of sleep anxiety. Number six, event stress or new job or new places. I have already told you these factors are also responsible of insomnia or sleep anxiety. Once any event is there, in that event, if it is stressful, maybe some negative factor, maybe somebody passed away, maybe some accident happened, or sometimes you are getting new job, very much thrilling, and you are very happy. Actually, excess of anything is bad. So if you are getting new job and very much thrilling, anxiety will be there. It will disturb your sleep in the night. And of course, if you are going to new place, new bed, new circumstances, again there will be development of sleep anxiety. Number seven, medical condition and medication. Medical condition means sometimes if you are sick, you have lot of muscular pain, maybe sometimes abdominal pain, or some other related disorder, that may also cause sleep anxiety. And also, if you are taking lot of medicine for different purposes, so lot of medication also is responsible of sleep anxiety. Number 8, too much stress, poor sleep, environment. Two factors are also there. I have already told you, too much stress, too much worry, too much irritation. Your sleep is directly linked to your mental health or mentally cool. Once there is anxiety, once there is worry, once there is overthinking, definitely you are not going to get sleep. You will be always in problem. And also, poor sleep environment. I have already told you, poor sleep environment means your room, your neighbor, densely populated, lot of crowd, lot of music. All these factors are together responsible. Number 9, lifestyle problem is alcohol, smoking, and then overweight, using lot of caffeine. So all these factors you have to take care. Number 10, depression and schizophrenia. Actually, the chronic condition of depression is schizophrenia. Those who are having this mental condition, they are suffering from depression or schizophrenia. They also get sleep anxiety, and sometimes they spend sleepless night. And number 11, wake up at 3 a.m. That is the disbalance of melatonin, sleep hormone, and production of more cortisol, that is stress hormone. That's why, because of that reason, most of the people, they get up early, even sometimes at 3 a.m. when the melatonin, sleep hormone starts reducing its production in your body, you will get up. So these are all factors, and these treatments, all you have to take care so that you will get sound sleep, and you will overcome sleep anxiety, and that is what I call it insomnia. And the mother of all those is nothing but that is called overthinking, repetitive negative thinking. That is triggering factor. So with this, I will stop. I wish that you are not compromising your sound sleep. Quality of sleep is very important. I am always telling in my lecture two things. Sound sleep means good sleep, and be hydrated means always take water, because water is a medicine. So always after every 1 to 2 hour time, go on taking 1-2 glass water. That will also reduce your sleep anxiety. Once again, thank you very much for watching the lecture.